Delighted to be joined today by Jessica Miller. Jessica is going to be speaking at our fall conference in our executive track, and her session is going to be successful AI integration into healthcare. That's a hot topic. In fact, we're currently designing an innovation program that we're going to put on next in the first quarter next year. That's going to do a lot of focus on AI and all the other technology that's coming online. So we will be in Indianapolis, Indiana, on September 26th to the 28th. Jessica is presenting on the afternoon of the 26th. So before we get into the session, let's talk to you about you a little bit. I see that you earned your master's in healthcare administration from the University of South Carolina. And from there, you went into the ambulatory surgery industry. I'll bet you were real popular with hospital administrators at that time.
Yeah.
And then you went on to regulatory affairs and physician credentialing.
Yeah, I had a unique track starting out into consulting from everything else, but I had a really excellent mentor. He worked a long time in the surgery center development space and took me under his wing. And through his tenure, we were able to develop over 26 centers throughout the United States. So got to do a great bit of traveling and learning about all the ins and outs of the regulatory environment, and then transitioning into the billing and revenue cycle stream for those surgery centers.
In what years were you involved with the ambulatory surgery centers?
I started fresh out of graduate school in 2007, and I did that for about 7 years. So then in 2015, I took a hiatus to work for a revenue cycle management company, managed a team of medical coders for them for a while, but still kept in touch with the ownership for the consulting firm. And I did some piecework for them every now and then, and especially as it related to some of their coding and billing projects. So it was nice to be able to continue that relationship with them.
Sounds like you've had a fun career. Well, let's get into this and talk a little bit about your session and what successful AI integration for healthcare means.
Sure. So what I'm hoping to cover in my presentation is what's going on in artificial intelligence as it relates to healthcare today. You mentioned we're having a lot of conversations about the impacts it's going to have on the delivery of care, the administration of care, and hopefully alleviating some of that overhead and administrative burden that a lot of our organizations are facing, whether that's from direct patient care in hospital settings or even just these revenue cycle management companies. We all felt the crunch of COVID and the quiet quitting and everything that came after the downfall of the pandemic. So really, we looked at artificial intelligence as a way to alleviate some of those constraints and give opportunity back to these organizations to capture some of that lost revenue, get caught up on their operations, and really bring efficiencies into their processes.
It's early to really talk about this much, but what are you seeing in terms of the impact of the chat GPT and that sort of technology that's coming online?
It's going to impact a lot of I would say society's acceptance of this technology, whether or not we're going to see it as a resource or if it's something that's going to replace, certain positions or people who, function in certain industries. For us, Metacodio as a company, we wanted to develop software technology that was going to be a resource and a tool. So for us, we wanted to look at it as an opportunity and really bring that technology and put it into the hands of the coders. So we are able to use this artificial intelligence to do code predictions, to do diagnosis predictions, looking at disease progression. We're utilizing it in some of the radiology technology. So it's got real opportunities for us to change the way we think about technology and how it is in healthcare. And ChatGPT is one of those first phases of, well, if I put this information in, what am I going to get out and what is that going to look like? And in terms of healthcare, we're looking at clinical documentation, looking at auditing. Is this going to be something that's valid for the patient medical record? Does it make sense if I'm having it generated by artificial intelligence? And all of that is just going to get easier and more improved in its responses as we see it progress over time. So, these are our infancy stages, like you said. We're in the very beginning of these things. Chat GPT, from a medical coder perspective, has been tested against some of the code generation technology that's out there. And, its accuracies isn't what we would expect to see, even compared to some of our engines. So it's good to know that what we're still producing in our technology is advanced beyond what they've created in their Chat GPT search and engine technology. So we'll see advancements quickly. But for right now, it's not a threat to our initial environment, and we need to kind of keep playing that feedback loop and providing that information so that we can see it improve and become a better resource for us.
We're spending a lot of time with the health plans on the commercial industry side, focusing on a lot of areas in pursuit of what the phrase that's termed administrative simplification. That's the buzzword that we use. And one of the areas we're finding with the commercials is that you have the diagnostic codes and you have the procedure codes. And oftentimes the diagnostic code doesn't support the procedure codes that are submitted with the claim, which creates a significant amount of denials. Will the Chat GPT or some other technology help in terms of the coding of the procedures in relationship to the diagnosis?
Absolutely. And I would, caution anybody using these online platforms. There's certainly better subscription programs and technologies out there in terms of software development companies that offer these types of services. You want to vet those through demos and, seeing those types of service providers at conferences. But certainly from a coding perspective, it is able to read an op report, generate some type of code description. But it's only going to be as good as the information that it's fed. And so constant updating, constant surveillance, and again, those feedbacks and education to, the artificial intelligence to make sure that it's staying up to date, because medicine and medical coding, they're fast and ever changing industries. And certainly in terms of payer policies and coding guidelines and all those things, we have to make sure that we've educated ourselves, educated our physicians, have our EMRs up to date. There's a lot of players in that chain. And so we all want to be on the same page before we can really progress in that.
Well, you've certainly picked an important topic, a broad topic, and so we don't want to dive too deep into it. We're really looking forward to all the information that you're going to be providing for us in Indianapolis. So we look forward to greeting you there, and I hope you can stay. And I want to give you a personal invitation. We're throwing our 30th year anniversary party on Thursday evening, and I'm sure hoping you can join us for that big party.
Yeah, that sounds excellent. I'm really excited. I was at HBMA last year as an attendee. I'm going to be there with Medicodio as a company exhibiting. So really looking forward to all of the networking and prospecting opportunities that this conference provides.
Well, you're going to have a big crowd to talk to, so we look forward to greeting you. Thank you so much for your support, and I look forward to greeting you in Indianapolis. Thank you again.
Absolutely, Brad. I really look forward to it. Thank you so much for the opportunity.
Okay, goodbye.